Okay, simple. We do not, you can say I would check the gag reflex, that's for the vagus nerve, but that's a very unpleasant test, and I must say that often not done because people have some people have very strong gag reflexes and it's very uncomfortable for them. Okay, so don't attempt it unless you have experience and you know how to execute this. Okay. Cranial nerve 11, the accessory nerve, right? Okay, so this is accessory and hypoglossal are purely motor nerves. Okay, these are some of the easiest tests, right? Because you just ask them, it's the sternocleidomastoid muscle and it's the trapezius muscle, right? So basically, ask them to raise the shoulders, right? Can you raise your shoulders for me? And I'm gonna try to press them down, and can you resist my motion? Perfect. Yeah, okay. And the sternocleidomastoid muscle, there's different ways to test this. I've seen ways where you stand behind the patient and you ask them to tilt the head, right, and look towards the side, and then you apply an opposing force. You ask them to resist that movement. I just do it from the front. Honestly, you can also do it from the front, okay? So you ask them, can you please look towards the door, okay? And I'm going to just touch your face, okay? Yeah, and can you resist? And the same thing, so can you turn towards this side? And I just apply resistance, okay? Yeah, so there you go. And hypoglossal, you can actually do, to save time, when they say and you get them to open their mouth, that's a great opportunity to also ask them to stick their tongue out, and then you're done with cranial nerves 9 and 12. Yeah, okay, so that's cranial nerves, okay? Sensory examination, exact same concept as we did for the face, okay? There has to be a reason for checking this, though. There has to be a reason, right? So they tell you I have tingling or I have numbness in the area, right? And then that's you want to avoid that area, right? So do it on the back of the hand or do it on the face, somewhere where they have intact, they have intact sensation first. And then again, close your eyes and tell me, is it blunt or is it sharp, okay? The dermatomal map is incredibly helpful. So know the dermatomes, right? But just broadly in broad strokes, right? C4, the clavicle area, okay? C5 is the deltoid, right? So you can test it here just over the muscle belly of the deltoid on both sides, okay? C6 is here, the thumb, okay? C7 is these fingers, so the index, middle, and ring finger, and also the palm of the hand. Most of it is C7, okay? And you've got C8, okay? So that's the pinky. And then